And hello, mateys, and welcome back for more abuse. Didn't get enough the last time, eh, Fernando? Okay, if you have any background noise in your abode, I would recommend you mute your microphone. I don't hear anything right now, so I think we're good to go. This presentation is going to be hopefully shorter than the last one. I went to an hour the last time. I didn't plan on going that long. When I rehearsed it, it was 20 minutes, but then nobody asked me any questions either. I could ask myself questions, but then I would probably get committed and locked up. There we go. We are still on mobility. Mobility, as Johnny's sitting there showing you, is very important. But this time we're going to talk about strains, sprains, dislocations, and tears. We're going to talk about where your rest of your anatomy attaches to your skeletal structure. Let's dive right in. Learning objectives. We will go over the definition of mobility again, just as a refresher. But we're going to look at some other functions of the skeletal system, the joints, tendons, ligaments, cartilages, what they do, how they do it. And then we'll look at a couple pathophysiologies. Now, with this concept-based approach I'm using, I'm trying to use 3 pathophysiologies, which each objective or each concept that I talk about, so that we don't overwhelm you with 15 pathophysics. At least that's what I'm hoping we do. Anyway, moving on. Int. Let me find my cursor. There he is. Pointer option. Boink. If you see this little fella on the slide, you may be seeing that information again. Mobility. It's the act of movement. It's the act of walking, exercising, doing activities of daily living, ADLs. And your nursing role is to not only maintain and restore mobility, but to detect any problems with it and prevent any complications. Boink. How does this all connect? We're going to go over 4 basic connections in the muscular system. Joint. Joint is where 2 bones come together. Easy enough, right? Tendon. A tendon is where the muscle attaches to the bone. You've heard of tendonitis. Tendonitis is when you irritate that tendon. If I'm doing like 300 curls or something crazy like that. Ligaments. Ligaments are what goes between the bones in a joint. And sometimes those ligaments will have a little pocket capsule in between them. And cartilage. That is the padding between where absorbs the shock. Moving on. Let's get a picture of that. Yep, oh, there we go. As you can see, here we have, let's start with the joint. This is the joint right here. 2 bones coming together. This is a tendon right here. As you can see, it attaches from the bone to the muscle. Those injuries, tendonitis, are usually overwork injuries. You, like I said, instead of doing 20 repetitions of a bicep curl, you end up doing 50 or 100. This whole tendon is going to get super inflamed and irritated with you. Ligament. A ligament is that band that goes between one bone and another. That attaches bone to bone. And then you have the capsule. Cartilage goes over the top of the bone and it's cushioning. Most joints will have this capsule in between. There's some that don't. But anyway, this is a fluid. This is filled with synovial fluid, and this acts like a big shock absorber. And we'll discuss more about that as we go down here. Okay, couple terms you need to know. Adduction, abduction. Adduction is when you're moving your arm away from you. Abduction, AB. No, I'll tell you a secret for that. Abduction, if somebody gets abducted, what happens? They're taken away. So, like your arm is being abducted. For those of you who saw Taken 1, Taken 2, Taken 3, Taken 4, Taken 5. So that's how you remember abduction, your arm moving away from your body. Adduction, ADD, is your arm coming closer to your body. It's almost like it's adding it to your body. So there's a couple secrets for remembering abduction and adduction. You all know medial and lateral. Medial is toward the center of your body. Lateral is away from your body. So if you do a medial rotation, you're moving toward your body. Lateral rotation, you're moving away from your body. Flexion, extension. You may see a couple of these terms on the test. Two more terms that you're going to run into a lot. Dorsiflexion is when your toe goes up. Planar flexion is when you go down. Here's the dorsal side of your foot. Here's the planar side of your foot. Dorsal. How many of you have seen a dolphin? That big fin on the back of the dolphin is called a dorsal fin. It's on the back or the top side of a dolphin. Top side of the foot, dorsiflexion. Dorsal side of your foot. Planar, plant. When you step on a plant, it's on the bottom of your foot. Trying to give you some tricks here for memorizing. I had so many acronyms when I was in nursing school, I felt like alphabet soup. Pronation is when you move your hand palm down, and supination is when you move it out this way. Probably won't run into that a whole lot, but kind of good to know. What happens when things go wrong? We're going to talk about these three exemplars: strains, sprains, contusions, dislocations, and tears. First one, strains, planes, and automobiles. How many thought trains, planes, and automobiles? I thought it was funny. Anyway, strain. A strain is injury to a ligament. You all remember what the ligament was? When the two bones attaches two bones together, right? If you pull that, that is a sprain. A sprain, a very common sprain is sprained ankle. That's when the foot, you step wrong and the foot twists. You're pulling a lot of those ligaments that connect all the multitude of bones that are in your foot. A strain is when you pull a tendon. That's an injury to the muscle. We'll talk more about these as we go along here. A contusion is a blow. It's when something gets hit, contusion. Usually results in inflammation, redness, swelling, hematoma, or what we used to call in the ER a hematomato. There's different degrees of injury. First degree is a mild pulling. There again, you're walking down the stairs, you twist your foot, ouch. Okay, you pulled the ligaments. Okay, it may swell up a little, but it's going to go away. If you have a second degree tear or a second degree injury, a sprain or strain, it's going to result in a little bit of tearing, maybe of the ligament or of a tendon. It's going to result in some edema and some ecchymosis. Did I put edema on there twice? I did. Well, that comes from the Department of Redundancy Department. Ecchymosis, you might want to remember that. Another word of ecchymosis, and that's another word for bruising, but you will see that in doctors and nursing notes, ecchymosis. Third degree injury, you get some severe tearing. Now, this is where you might require a cast, or they might even have to surgically go in and reattach the ligaments or the tendons, because you'll get loss of function with that. That's the big thing there. If it's third degree, you're losing some function in it. Somehow I think you might see that again. Dislocations. This is the word I was trying to think of in the last lecture, and I couldn't think of it. But a dislocation, when something comes out of joint, very common in shoulders, hips, knees, can result in distortion. If somebody dislocates their shoulder, can't believe I couldn't think of that word. Anyway, you'll see, well, you look at them and they'll look like this. They'll have a regular shoulder over here, and this one, the head of their upper arm has shifted downward, and you have them sit there and put their hands on their lap, and you just reach out and you can see the deformity. Dislocations are pretty common. They're also pretty easy to fix. That's when we bring them into the ER and do what we talked about in the last lecture, which is a reduction, where we basically there is a particular way that the doctor can manipulate the arm. It's a rotation and an extension, and it just pops the socket right back in again. The problem with dislocations is the more you dislocate, the more common the dislocation can become. In other words, if you pop your shoulder out a lot, the tendons, the ligaments get stretched, and you're more inclined to dislocate it again. Dislocated knees are very painful. There again, looking at this word right here, compartment syndrome. A dislocation can impinge nerves and vessels and cause damage distally to wherever the injury is. Moving on. As I said, frequent dislocations will loosen connective tissue as you go along. So, boink, you might want to see this again. Here is the image of the dislocation I was looking for in the last lecture. That is a dislocated shoulder. That's a great photo. Tears. Tears, of course, is when you tear something. The first common is rotator cuff tear. A lot of sports injuries. This shoulder up here, this is your rotor cuff. Pitching, throwing, wrestling, whatever the case may be, they wind up tearing one of the several muscles here. Very common, especially among weightlifters. Ligament and meniscal tears, those were common in the knees. You'll hear people coming in and getting their meniscus scraped. Meniscus is this little layer of tissue, I believe, Eileen, correct me if I'm wrong, but I believe the meniscus goes between the ligaments or between the bone and the ligament. I'm not sure. I think maybe above the cartilage. I think it's above.
I can't really remember myself.
Yeah. Anyway, it's a little thin layer that goes around the cartilage, I believe. And quite often in sports injuries, as the knee gets beat up, this little layer will tear or rip. And when it does that, it'll like fold up. Kind of reminds me of when you peel an onion and got that little thin layer there that kind of comes off. If that rolls up in the knee, it's very, very painful. So surgically, they just go in and they just scrape that meniscus out of there so that it doesn't ball up and cause pain. Very simple procedure. But that's when you'll often see meniscal. They go in and they scrape the meniscus out. That's how they handle meniscus tears. Ruptured Achilles tendon. This is what killed Achilles. Everybody remember the legend on that? Evidently, Achilles' mother held him by the ankle and she dipped him in this protective magical solution so nothing could kill him. But where she was holding him by his ankle, it was not protected. So an arrow hit his Achilles and killed him. There you go. That's your Greek literature lesson for the day. But that's where that Achilles tendon got its name. And when those rupture, your calf muscle balls up and it's extreme. I've had tendonitis of the Achilles before. It's extremely painful. Here is the example of a bicep tear. His ligament or his tendon tore right here, and his bicep just rolled up in his arm. I love that picture. Ouch. Medical surgical management of these things. Strains and sprains. Remember the old acronym: rest, ice, compression, and elevation. Eileen, didn't they expand it to price, I think, at one point?
Yeah, it could. Um, you know, I just remember rice myself. So
Yeah, I think they might have put pressure in there or something, but I'm old school. So rice, you need to rest the injury, put ice on it. Usually we used to say ice for the first 24 hours and then heat. But what the ice does is it helps keep the swelling down. When you get the injury, you have an inflammatory response. Blood and everything rushes to the location and causes a great deal of swelling. So the ice helps keep some of the swelling down. Compression, they can use compression bandages on it. Usually helps the wound feel a whole lot better. And then, of course, elevation to keep the blood from flowing into the location, causing more swelling. Dislocations, usually those have to be reduced or put back in place and then splinted. And you have to wait a certain period of time for those ligaments that have been stretched out of shape. Over time, they will tighten back up again and you can go back to normal. With the shoulder dislocation, we would put it in a sling that ties to the body. It's called a sling and swath. And that just keeps the shoulder immobile while those tendons tighten back up again. Tears. Some tears will heal. Some tears, if they're minor, just stay, but you just live with it. They kind of go away, so to speak. And some tears, like that guy's bicep, you have to go into surgery and they have to reconnect the muscle to the bone. Medications, anti-inflammatories and pain is the major medication for these type of injuries. But do use caution with NSAIDs. We know how, from your pharmacology class, you know how it affects your stomach, the acid in your stomach, you know how it affects your kidneys. Ibuprofen and ibuprofen products can be really hard on the kidneys. NSAIDs can be rough on the stomach acid. Nursing management. Couple nursing diagnoses. Impaired mobility. That's obvious. If you damage a tendon or a ligament, it's going to impair your mobility. Pain, as I just talked about with the NSAIDs. And risk of ineffective tissue perfusion. Let me move my little thing here again. Okay. There again, we were talking about any kind of joint injury. You can impinge your nerve endings. You can impinge your vessels. Keep an eye out for perfusion. Fistal checks. Make sure everything is flowing well. And I do believe, you may see something about this again. Hi, guy. There you go. And we're done. That was a whole lot faster than the last one. So I'm going to stop the share and open it up for questions. Any questions?
Where are these Zoom meetings located, or if we can access them? Because I didn't know that there was one this morning, and I totally did not come.
Yeah, that's fine. The Zoom, under the modules, in module week 3, you saw mobility part A, and it gave you the link to attach to that lecture. I'm going to go back in and remove the link because the meeting is over, and I will put a link to the recording, the Zoom recording. Now, what I'm doing is I'm downloading the presentation to my YouTube station so that I'm storing it on YouTube instead of storing it in Canvas. That saves storage space for us. And then I'm putting a link in that module. I'll put a link that takes you to that YouTube presentation. Much the same way I'm doing with the crash course. You saw they had the crash courses up there, crash course 19, crash course 20. I'm linking you to YouTube video and you just watch the video. That answer your question?
I don't see the, is it supposed to be under the modules for the crash courses?
No, you go back into the module, you go down to mobility part A presentation.
Okay, yeah.
In there will be the link.
Oh, okay.
Yeah, because I haven't got everything transferred yet.
Got it.
The Zoom meetings
Right.
are also
That
on
sounded
the
strange.
calendar.
I will be posting that in the same place.
Stop.
You have a very active household there, Johnson. Eileen, do you have anything to add?
No, I don't. No, not right now. A good thing you were talking about inflammation, and last week that was one of the subjects was inflammation and how NSAIDs are great and then they aren't so great. So it tied in nicely.
Yeah. I'll be talking more next week. I cover inflammation and infection as they relate to the musculoskeletal system.
Okay.
So I have a question. So we're supposed to do the crash course 19 and 20 because I only see 19 posted.
Well, 20 will be next week when I post
Oh,
next week.
okay. Okay. Just
I mean,
check.
you can always go into YouTube and look it up for yourself if you wanted to, but and I should probably just publish that now along with the PowerPoints, but I got to finish up and polish up the PowerPoints before I publish them.
Okay. I was just checking. Thank you.
I will stop if there's no more questions, I'll stop the recording.
Okay.